Hi, hello, namaste. We are with prestigious gynecologist Dr. Divya T. Sudarshan Garu. Namaste, madam.
Namaste.
So, thank you for accepting for this interview, ma'am. Actually, we are very privileged and proud of your team and your works.
It's very sweet of you to even think of me for the interview. So I'm equally obliged and I'm equally happy to meet you.
Okay. Doctor, to begin with, I would like to ask you a few important things that are related to women health.
Okay.
Which will help our viewers and also readers. There are 3 topics we have chosen from the audience, ma'am. That is PCOS, PCOD and thyroid. So we'll start with PCOD and PCOS.
Okay. So what is your question? First question. I'm sure it is what is the difference?
No, ma'am. Actually, yes. Obviously, we'll start with what is the PCOD and PCOS?
Okay. It used to be called PCOD only. And it was called polycystic ovarian disease. The nomenclature changed to polycystic ovarian syndrome. Syndrome basically means when a lot of symptoms run together. So this is because of that. So usually in PCOS, you'll start seeing there'll be either a little bit of weight gain, there'll be a little bit of hair loss, there'll be a little bit of facial hair that happens, acne that happens, irritability, mood swings. These things happen along with delayed cycles.
Okay.
A lot of times we find that in about 40% of patients, PCOD patients will have regular cycles. So that becomes a problem because patient says, all this is happening, but my cycles are regular. I don't need to see a gynecologist.
Of course,
right?
Yes. Most of the patients will think that way.
Exactly. Yes. So, unfortunately or fortunately, a regular cycle will actually delay the patient coming to the doctor. Because they are thinking that because my cycles are regular, everything else is regular. That's not necessarily true. Okay. And you can have patients who've got very delayed cycles who will not maybe have
all... What is the duration of delay,
so a normal cycle is around 25 to 35 days.
That will be cause...
That is okay. So, if you have a cycle by 25 days is also okay, up to 35 days. If it starts getting shorter, then it's worrying. If it starts getting longer, then it's worrying. Same way, bleeding. We want a bleeding to be ideally 3 to 5 days maximum.
Yes.
If it starts bleeding for 7, 8, 9 days, you need to see a doctor. And if it is less than a day, then you need to see a doctor. Right? So, there are ranges for more and less, both. And it's a question of what the patient feels is important. See, this is again another thing. The patient is normal. Gynecology is not a, like I was telling you, it's not a sad department. It's not a sick department. Patients are usually healthy. They have little things going on. So, it's like having a punctured tire. There's nothing wrong with the car, but then you repair it and carry on. It's like that.
So, what are the signs they should be mind in their this PCOD disease?
Okay, so most of the time, the first thing they'll notice is there'll be a slight delay in the periods. So, it may, instead of 30, 35 days, it'll come at 40 days. Now, we expect 1 or 2 cycles delayed in the whole year is expected, right? But if it keeps happening, you're supposed to watch it for at least 3 to 4 months. And you find, no, it's consistently getting delayed. Then it's time to go and pay attention.
So, ma'am, this is increasing in many populations in the women.
Yes.
What may be the reasons? Could you please tell us, our viewers?
Okay. One thing is, genetically, South Asians are known to be, pro-PCOS. We tend to have more PCOS. If you know that India is the diabetic center.
Of course, ma'am.
So, there's a connection between PCOS and diabetes. Patients who have PCO have a higher tendency towards diabetes. They tend to become pre-diabetic early. They even tend to have full-blown diabetes earlier. Especially if there's weight gain also along with it, then it's going to become a mess. So, whenever this thing, one of the first things we'll always tell patients is stop eating rice. And they keep thinking, why is this doctor stopping me? But rice is the easiest thing to eat, right? And you just put
while taking the rice, they'll increase the... People think that they'll increase the insulin levels like
yes, sugar. There is. But also, see, chapatis also are carbohydrates. They also increase insulin level. But we are not that comfortable making 12 chapatis. It's very easy to siti bajao, and get your rice. So, rice is, and otherwise also for South Indians, rice is our staple. It's sambar rice, rasam rice, curd rice, everything is rice. Right? So, dosa is rice, idli is rice, appam is rice, everything is rice. So, that kind of, you want them to go towards complex starches, reduce the easily absorbed starches, reduce your sweets, reduce your easy starches. Then things will improve.
So, what is the diagnostic test for this PCOD and PCOS?
Right. Now, we do 2 things. One is we do an ultrasound also to find out
whether... It is necessary, ma'am?
Yes,
ultrasound?
yes. You know why? Because a lot of the times, the patient, when we do an ultrasound, if we don't find a cyst, then also they are like, oh, I don't have it. So we have to do blood tests.
Many of
Yes.
the younger women, they
Yes.
think that they don't have any
Yes,
PCOS.
yes.
But when it comes to the for early marriages, they'll find this reason.
Yes. And another thing that we see is that if you do it and you're able to show it to them, they're a little more open to getting treatment. Because otherwise, if I say, I know, see, PCO is a clinical diagnosis. That is what we tell every patient. That this is not just, okay, chemically, these are your hormones, physically this. When we look at a patient also, sometimes there may not be anything majorly wrong, but it's like, when you, it's like so many things that you assess. If you now say four-legged animal, it can be four-legged animal is cow also, it can be giraffe also, it can be horse also, it can be anything.
Yes, sir.
Right? Yes, whereas if you have seen, now somebody says, this is an okapi. Somebody who has seen an okapi will know what an okapi is. Yes. You don't know what it is. That is like PCOD. Gynecologists see it all the time.
Yeah.
So we know this looks like PCO. So there are so many times, when you're watching, like maybe I'm shopping and I look at this thing and suddenly you can say, okay, my God, full-blown PCOS. It comes automatically to your mind. Yes. But we're not going to go and tell the patient, okay, go and meet your doctor.
Yes. So, ma'am, is there any interlink between the PCOS and infertility?
Yes. Now, the problem with PCO, actually what happens is that patients, what is the reason her cycle is getting delayed? That most of the time she is forming this polycyst that we're talking about. Yes. These small cysts are only because it's not forming a large follicle. So a large mature follicle which is supposed to ovulate is usually between 18 and 22 millimeters. Polycysts will be around 5-6 mm. Okay. So you will have, instead of her making one big egg, she will make 4 small eggs. Now, 4 babies don't equal a mother. So that's it. So these little eggs will go on forming these polycysts in her ovary and it will make the ovary bulky. In fact, we've got this thing. It will look like a pearl's necklace. So we call it the queen's necklace appearance in the ovary. Okay. And because she's not ovulating, conception becomes a problem. So most of the time, whenever a patient comes, it's, their success in pregnancy is pretty good, provided they have to do 2 things. One is you meet a doctor. Second, you be a little patient. Because you're not going to conceive immediately. We have to give you some pre-treatment, settle your hormones, give you about 4 to 6 months of medicine, you'll become pregnant.
Ma'am, is another concern is obesity. Obesity leads to infertility in women. Now,
this is again a thing. Obesity by itself does not lead to infertility because, there are sometimes my patient will turn around. When I tell her she's around 85 kgs and I'll say you have to lose 10% of body weight. She'll look at me.
Most of the gynecologists in the areas, they are suggesting you have to lose the weight to get the pregnancy.
Yes. So now the easiest way to understand, let us say you've got a pencil box with a stack of pencils out here. Right? So this is your pencil box with a stack of pencils. You've filled it up. That is your weight. How is there going to be any movement in the hormones? Pull out 5 pens. You will find things moving.
There will be some space.
Some movement.
Yes.
So nobody is asking you to become, really slim and become a supermodel. We are only saying lose 10%, lose 5-6 kgs. That will allow the hormones to move. Yes. That's enough. That's all you need. That will allow it to start moving.
Okay. Ma'am, one more thing. When people going to visit the temples and so they'll take pills to stop their menstrual cycles. Is it good or bad? And how it will affect their future?
See, honestly, this is a new thing, right? Because my mother and your mother never took any tablets.
No,
they used to just arrange and they would turn around and say, if you couldn't go to the temple, you would say, okay, God didn't want me to come. But nowadays, we are trying to play God. So we say, okay, fine, let's take the tablets. Most of the time, if you go to a gynecologist, we will give you things which are given over 5 days, 7 days, like that. This one-shot tablet here and there is like throwing in a screwdriver into a machine, which is not the smartest. But yes, when it's required. A lot of the times we do it when a patient is getting married because, they have pujas and stuff like that. So we are scientists, but we have to understand that we are in a social thing. So to some extent, you have to understand that patients have their limitations. Nowadays, people are making their plans for vacations very quickly. And, suddenly they get an opening for Tirupati to go and they decide I'm going to fly. So I cannot ask them to go on this. Sometimes, yes, we do help them, but they should be ready that their cycle may be delayed. It may be heavy the next time. And maybe the next couple of cycles would be a little off. You should be ready for that. You cannot expect that I'm going to use this and nothing is going to happen. Right?
What is the right time to consult the doctor? I mean, gynecologist for PCOD, ma'am?
Uh,
What are
wha-
the signs they should analyze? Like most of the young women, after the hair fall and they'll get some pimples on cheek and oily face. These are all indications for PCOD.
no.
Physical,
Okay.
physical
No,
diagnosis.
I'm sure you remember how you were when you got your periods, and I remember how I was when I
Yes,
got my
ma'am, yes,
periods.
exactly.
So there is that, we all go through that ugly duckling phase. So
Okay.
let's say you got your period at 13.
Huh.
Most of the time, we know for the first 2 years, the period is going to be erratic.
Okay.
There are going to be a lot of changes in your body. So
Mm.
that is the time, you'll tend to put on a little bit of weight, breasts will become enlarged,
Yes, yes.
acne comes, you lose
Yes.
hair. That's a normal thing. So
Okay.
normally for up to 2 years, 2 to 3 years after your period, we don't usually do anything unless the girl is gaining a lot of weight, in which case we tell the mother only watch her diet.
Okay.
That's all.
So,
We see for iron and calcium.
so
and vitamin D.
major symptom is gaining a weight in
Gaining,
PCOD.
yes, but that will be only after. So if she's got her period at 13, for 3 years, I'll not even get a scan done. I'll only check her iron blood cells and just leave her alone. After that, if it's 3
Okay.
years of getting your period, then we watch. Then we say, now why are things happening? Now I have to see.
Okay. This ovulation affects the PCOD?
Ulta. PCOD affects
PCOD
over.
affects the, yes, yes. Sorry.
Yeah.
Yeah.
Please, that's what I was telling you, that it doesn't make mature eggs. It makes a lot of small baby eggs.
Okay.
So that way it will not ovulate. So for this, first we reduce your hormones in such a way, or we
Okay.
stabilize your hormones.
Mhm.
We allow you to make you, allow you to change your diet, lose weight, a little bit of lifestyle changes, do all that.
Mhm.
And then after that, when they really want to become pregnant, we stimulate and then they start producing eggs. So usually it's something which is very manageable. But the problem again is, we have now become the Swiggy generation.
Okay.
That means you sitting at home and you think, I want my potatoes now. So
Yeah,
the
yeah.
patient, from wanting pregnancy and not wanting pregnancy is just one day. So now
Okay.
today her friend will turn and say, guess what, I'm pregnant. And she'll turn and say, I also want a baby. Right.
Yes, ma'am.
But it's going to
Obviously.
take time.
Yeah.
So when you know that a baby is possible on
Yeah.
the agenda, it's
Okay.
there, start doing whatever you need to do to change your lifestyle so that when you want a baby, you can have it.
Yes. Ma'am, another question is like, what is the correct age to get married?
Ah.
For children. Most of the reasons are not getting the children is like their age about 30.
You
and
know what? The
35.
ideal age is always 23 to 30. Is
Oh.
in the olden days, we would say 18 to 25.
course,
Now
but-
they've said 23 to 30. But let's be honest, most women are, finishing their education by the time they're 24, 25.
Yes, ma'am.
They all want a career. They also want to meet a guy who's the right person. You don't want to get married. That area of arranged marriages now have changed. So you're not ready to marry the first person who comes. You want to meet somebody who's good. So that takes time. And then it goes on. But you also have to understand modern science in one way has been good. We've managed to push fertility age. So even though ideally we would want you to get pregnant and be done with by 35, we have got enough things to push people. So you find more and more people. Like I said, if a Deepika Padukone and a Katrina Kaif can
Of
have babies
course,
at 40
yes.
plus,
Yes, ma'am.
you can too.
There is a
But
money matter also, right, ma'am?
it's not only the money matter. See, ultimately it was her uterus that held the baby.
Yeah.
It was her ovaries and
Yes.
whatever. So yes, there is definitely some degree, because we are looking at, possibility of, yes, going in for higher things like IVF and this and that. But pregnancies do happen. That is one. And the second thing is that if they're able to take care of their general health and they're able to maintain their, what shall I say, fertility, these things, and they're able to follow up with the gynecologist, we do certain tests for knowing whether a patient is, is in their optimum fertility or not. So when there's a test called AMH, which is an
Yes.
anti-Mullerian hormone, which tells us FSH, LH, prolactin, all these things we do. So when we know that these hormones seem to be okay,
Yeah.
we'll usually give the patient time and tell them, listen, friend, you can do it till now.
Yes.
After that, things are going to become
Yeah.
difficult. Yeah.
Another family question is this, like for the infertility, most of the families put fingers against the woman only.
Mm.
So is that
Yeah, you
true?
got my favorite question. Yes, it is true. Especially in a country like India, it is true. And we have to look at it in one way also, that the nesting instinct is also a woman's. A woman wants a baby. So she somehow feels more responsible for everything that is
Yes.
happening.
Exactly.
So even if both of them together have a problem,
Yes,
she's
ma'am.
the one who feels inadequate because she feels I'm not able to
Yes,
have the
ma'am.
baby. Right?
Most of the people also will
Yes. And over time, our culture has been such that marriage has been very high on the cards.
Yes.
And then next is baby. If you get married, the next thing in a year or 2 years, you should have a baby.
Yes.
So if that doesn't happen, it becomes a problem. Till now, other reason was that the woman was always at home. So she was the one who really was going crazy about having this baby, and she was the one who was listening to everything that relatives and everyone said, oh, you're not pregnant, you don't have this thing. And men, it's easier because he's going out and he's meeting 10 different people, so he doesn't really remember that, okay, I don't have a baby. He's fine with it because it's a male thing, isn't it? Like they're not really nurturing and babies that. But now we've realized that men have become more open to the idea that, okay, I think I told you, the equation between men and women have changed. Women are also working.
Yes,
they're finding partners who think like them. And men have changed over the years. The kind of tough person my dad was is very different from the person my husband is. And who will be very different from the person my son will be. So things are changing.
Yes,
so now I always say the man and the woman must be investigated together. The first time they come, check both of them.
They should take the blame both.
Let's not call it blame. We'll call it responsibility.
Because always the people will blame the woman only, ma'am. In this particularly infertility, when it comes to infertility.
Yes. But now we have shown that it's almost equal. The male factor, female factor are almost equal. 40% and 20% is unexplained. That means both could be okay and still they don't get pregnant. So that could be a thing. That is unexplained.
Ma'am, is the at the age of 45 to 50, there is a chance of pregnancies?
Now this is not the usual thing. So this is like climbing Mount Everest.
Actually, when I'm going to the social media, there is a surprising reels are there. Like I am 45 age and my husband is 50. We are now pregnant. We are still waiting for. This is a waiting period for,
we have seen this, and this happens in women who have already been pregnant before. So a lot of the times what happens, it's a shocker pregnancy for them. So I had this patient who came to me who was 45 years old, and actually she had come for postponing her periods because it was her daughter's engagement. Her daughter was getting engaged and she wanted to postpone periods. So I asked her, when was your last period? So she said about 2.5 months back. So I said, were you getting regular periods till then? She said, yes. But she says, I'm in menopause, I think. That's why it's not come. I said, whatever it is, we always do a pregnancy test. She said, at 45, madam, what is this? So we said, no, let's do it because we have to scientifically be sure that there's nothing wrong. And it came out positive. Then there was a lot of crying in this because they were really not expecting it. So it does happen. Out of the blue, pregnancies do happen. So contraception is important.
What are the lifestyle they should, for pregnancy, what are the lifestyles they should take care, ma'am?
I think
duration of pregnancy also.
I think mental peace is the first thing. Because if your mind is happy, automatically you'll do everything for your body to be happy.
Yes.
Right? It doesn't work the other way around.
Of course.
Like if like there are so many, it's like diet. Where your body is happy, but your mind is not happy. Because you're constantly thinking, yaar khana nahi khaya, I've not eaten this, I've not eaten that, my friend is eating chocolates. So it's not. So there your mind is not happy, but your body is, is like, okay, it's settling down. So I think in pregnancy or in any time for a woman, we have to find a way to be mentally happy. We have to find things that keep us. So, this is a lovely thing that we've got this flower. I always say that this center part is the woman. And these are the petals. This is your babies. This is your kids. This is your house. This is your car. This is your car loan. If this is okay, these will stay.
Yes.
That's
nice example, ma'am.
Yeah. So you have to, the woman is the core of everything. So if she is not happy, so a lot of the time I find, in fact, I even I usually spend a lot of time with my patients and I tell them, don't make the mistake of, giving too much from yourself, right? Get a little help from others. So, you don't have to do everything. If you're doing this, tell your husband to do something, tell your kids to do something. It's all right. You should do it that way. That simple example of the oxygen mask in the flight.
Yes.
That put on your mask first before you put it for the other person. Otherwise, you're of no use.
Yes. One more question is like, when is the pregnancy starts, women get vomitings more.
That is
what may be the reason?
There's a sudden rise in hormones. See, till now there was nothing. Now you're making this baby and this baby is starting from 0. That means, or rather 2. 1 plus 1 and you've made 2. And that 2, do you know what is the weight? Just guess the weight of the baby in the first 4 weeks. What is the weight, do you think?
Approximately 0.4 grams, like that, ma'am?
It's around, it's about a gram.
1 gram? Oh my God. Okay.
Now, when it becomes 12 weeks, 3
Okay.
months, what do you think is the weight?
Around 200 grams?
No, 12 grams.
12 grams only.
And what do you think is the weight at 4 months?
4 months? It's around, obviously, 300 grams.
No, 100. So now you have to understand.
The baby weight?
Baby is now forming structures. So it is like a little doll where you're adding pieces to and everything till 5 months. That is why we do the TIFA scan at that time. And after that is when the baby actually gains weight. So now when you tell the patient, she says, madam, I cannot eat anything, cannot eat. I said, it's all right. Even if you don't eat anything, the baby will grow. Because it's only 1 to 12.
Ma'am?
It is only 1 to 12 grams, but it's every gram is gold. So now you know the difference between 1 gram gold and 12 gram gold.
Yes.
Right. So now there is a sudden rise in hormones. All the hormones are rising. And that is what causes her nausea. So she starts feeling a little sick. So there are ways to combat it. You know, you change what you're eating. You change how you're approaching food. You change how you drink water. One of the tricks we tell is never fill your mouth. No, never drink water like this. Because at one moment it fills your mouth, there is what we call a gag reflex. The patient automatically wants to vomit. Use a straw and keep sipping. You'll find you'll be able to keep water inside. So there are lots of little things. Tell you to smell ginger. Ginger's got a very strong smell. And it'll trigger the, sense in part in your brain which reduces nausea. So same thing, smell oranges. So you can do a lot of things. Ultimately, you're tricking your body. Yes, you're tricking your body to saying, I'm not feeling nauseous because the nausea trigger is in the chemoreceptor trigger zone in your brain. So if you can con that, you can convince yourself to some extent. At least 80% of patients, yes.
Thank you, ma'am. And what are the reasons for abortions, early abortions?
Now you'll be amazed, almost 20% or 30% of all pregnancies will miscarry in the first 3 months. They are not that rare because the quality of the sperm, the quality of the ovum, so it doesn't create a good embryo. And nature does that. Anything that is not good, it throws away. So if you find even in mango trees and all that, when you go as a kid, you used to play, you'll find all the little mangoes would have fallen off. Quite a bit would be there. So they are all the ones which are not going to become good mangoes. They fall off. And so nature does that. But yes, after the first trimester, when you lose pregnancies, then we definitely keep this thing. After a lot of these times in the early pregnancies, you'll not even see cardiac activity. But sometimes when you do and it happens again and again, then yes, we will investigate it.
Okay. Ma'am, is there a height matters for the pregnancy?
Which height? Height matters for delivery, not pregnancy. Height matters for delivery. Because see,
the short women get pregnant.
Short women will get pregnant. They will get pregnant. That's not a problem. See, again, look at parts of India.
I heard that short women get very complicated pregnancies.
No, that's what I said. Look at different parts of India. There are parts of India, like go to the northeast, all the women are short, all the men are also short.
Of course, ma'am. I agree.
So now the babies are going to be like that. Whereas here you've got completely different. You have a small woman who's married to this tall Punjabi fellow. They fell in love, right? Now the genetics are there. Now she's going to have a nice little laddu baby. And that may not be able to, the baby would become this thing. So it's not. Height as such does not cause a problem in pregnancy. Except for the fact that yes, if the baby is growing, they will have, because you have less space. So yeah.
Ma'am, another segment is like, what is thyroid?
Okay.
Most of the women are facing this issue. And at the point of degree age group, women's.
Actually, see, thyroid problems were known. They are known in all places which are far away. So, the Himalaya foothills was known. Whole of that Nepal, Sikkim, Uttarakhand, then even Sindh. They were the common places, sometimes even up to Vizag, we've seen this thing. They were the places usually. That is why India was one of the first countries when we found so much of goiter and thyroid problems, hypothyroid problems. They added iodine to salt. So, iodized salt is a very important thing in India. Because that iodine was missing in the food, and that is why they tend to develop these issues, right? Now, before thyroid hormones, the problems existed the same. It's like cancer. The problems existed even then, but we were not able to find it. Now, thyroid tests have become so reasonably cheap and so regular for us to do in everyone that we find more cases. One. And medication is easy. All you need is that you just take it and that's it. So, whenever patients ask you that, madam, do I have to take it lifelong? We turn around and say, are you going to add salt in your food lifelong? Yes. Of course. This is salt in your life. This is salt in your body.
What is the diagnostic tests for this thyroid, ma'am?
Most of the time, again, a lot of the times patients will just routinely come in young girls, delayed cycles is one thing we see. sudden, again, weight gain, sudden anemia, tiredness and all that, a dullness in their hair, dullness in the skin.
Yeah.
She herself will feel that there's...
These indications will tell us there is a
Usually a hypothyroid patient will be brought by the mother. They will turn around and say, she's not talking. She's become very dull. She's, just gets angry with everything and she's going and sitting alone. Because there is that dullness. You know why? Thyroid hormone is the hormone that allows oxygen to enter cells. So when that is missing, your energy levels come down. So that's it. So obviously when mothers are the first to spot something when the energy is not there, right? Because they know how their daughter has been till now and suddenly they find that she's so, things are changing. So they will bring the daughter and come.
Ma'am, junk food.
Again, this is complex carbohydrates. This is very easily absorbed carbohydrates. Yeah.
So that will affect the thyroid?
Everything will affect the
because
weight. Everything will affect the weight and the weight will affect your hormones.
Okay.
So your weight is a very important thing. Do you know the average weight of the Indian woman? We're not talking about Bengal famine times. We're talking about normal times. Even 20 years back, the average Indian weight was around between 45 and 55. Today, the average Indian weight is we're looking at 60 to 75.
60 to 75.
Yes, I'm seeing teenage girls who are 60 kgs, which things are changing because again, like I said, working mothers, Swiggy, pocket money, exposure, friend groups, a lot of things are changing in India and we have somehow not understood that the changes that we are making to our food is going to change our lifestyle and our bodies.
Okay, ma'am. What is your suggestions for working women?
For working
by
women,
handling families, pregnancies and
take help always. India is one of the, I have my lot of people abroad and my sister's lives abroad and I always tell her that whenever I go to meet her, when she tells her friends, my sister has a cook and she has a driver and this and that, the first question they ask me is, how much of money do you make? And I say, actually less than you, but we are lucky. In India, we have help. We can get help.
Yes.
Why aren't you taking it? Right?
Yes, ma'am.
And it's going to be a very small amount of your income that you're going to spend in health. That person gets to live their life and your peace of mind increases dramatically.
Yes.
So if you can get somebody to, help you with whatever, do it. And if you can't afford that, then train the people in the house to help you. There is no harm in asking your husband, okay, when he is cutting bhindi, don't turn around and say, this is too big, too small. Let him cut it however you want. You're going to cook it anyway. Good. Yeah. So, your relationship changes. You help each other. You're not taking all the strain on yourself. You learn to help each other. Yes. So I don't think women should give up their jobs. I have been a working woman all my life. Yeah. And so is my daughter. And I believe that we contribute to the society. We contribute to families by working. We become much better women. We become stronger women when we are working. So we should not apologize for it. Okay. There's no need to apologize. You're a working woman. I'm a working woman. What's wrong with that?
Yes. Thank you so much for your valuable suggestions and guidance to our viewers, ma'am. Thank you so much for having you here.
Thank you. You made it a very interesting questionnaire. I didn't even realize I was giving an interview. So I don't know now how it's going to turn out, but let's see. Thank you so much. Very sweet of you.
Thank you, audience.